Okay, day two, we are case 6B, the traumatic brain injury, Brittany. Okay, so the key findings from our initial evaluation include her cognition was impaired. She was severely agitated as measured by the agitated behavior scale at a 41 out of 56. Anything above 36 is considered severely agitated. And looking at balance, Brittany had good sitting balance, was able to stay upright with no significant increases in sway. She did have increased sway with standing balance, especially with initiation of movement. And that was kind of shown with her high impulsivity. When she would move really quick to go somewhere, that's when she would kind of lose her balance and have that increased sway. And then she had decreased dynamic balance during gait. She just had a lot of impulsive movement side to side, running into her walker, running into the walls, just a poor overall balance. And then her coordination was poor, as shown by that gait and the same things I just kind of said. Neurological findings, we did not find any tone impairments in the lower or upper extremity. Sensation was unable to be measured accurately because she was not really responsive, wasn't able to follow commands, or didn't have great reliability for us. And then she did have withdrawal from touch, so that was intact. As soon as we tried to touch her, she would withdraw, which kind of shows that some sensation is there. And then for vision, she was unable to track the therapist's face, and sorry, we are unknown if that's due to her agitation, not wanting to keep eye contact, or to actual visual issues. We'll have to keep looking at that as we continue. Continuing on, she had some good transfers, kind of showed that she has good functional strength, as we are not able to conduct actual manual muscle test grades just because of her impulsivity and behaviors. And then the impulsivity during those transfers kind of leads to safety concerns. She just moved very quickly without really knowing where her body was in space, leading to loss of balance and a lot of increased sway. During walking, she demonstrated a scissoring gait and increased postural sway. We placed her at the functional ambulation classification level of 1, or dependent, meaning that she needed someone touching her the entire time in order to guide her or keep her from running into things or losing balance. She needed excessive verbal and tactile cueing to use her assistive device, which we gave her a 4-wheeled walker. So she needed excessive cueing to be safe and use that device appropriately. Standing balance, as we kind of said, she had increased sway. Subjective information, we do not have any current information about her personal or family history, and so it's kind of difficult to decide on goals, interventions, but she did, throughout the session, she was looking for her dog, or a dog, and so we're kind of wondering if we can use that in future sessions. And then here's our ICF model. You can see a lot of the things that we've already talked about. It's kind of hard to get her patient-identified problems just because of her confusion and agitation. For the environmental factors, we are thinking she has some positives in a young age and her functional strength, but she is impulsive and confused. And then we're not sure about her social support at the moment.
And for interventions, today we worked on gait and we want to continue to do that in the future. We also would like to continue with balance, sitting and standing. Sitting was looking good, but standing, we, as Maddie mentioned, could use a little bit more progression there. And then also stairs. So we want to continue using the patient's desire to just get up and moving. We wanted her to be able to get back to ambulating in the community as well as in household. And then with the balance, we just really want to reduce her risk of falls and then just all together increase her independence with all of these interventions.
So the long-term goal that we had for her was for her to progress to a level 3 on the functional ambulation classification in 4 weeks, and that was just for her to have more safety for discharge. We're unable to fully determine if this aligns with her goals just due to her agitation and confusion, but because she was asking so frequently to get up and move during the evaluation, we wanted to do a long-term goal that was progressing her ambulation and just noticing that she needed a lot of safety awareness with that as well. Thank you, friends.